Good afternoon, everyone. It's a pleasure for you to join us on this gloriously sunny afternoon here in London. And welcome to the open day for the Masters in Cardiovascular and Respiratory Healthcare at Imperial College London. My name is Dr. Leanne Falkin, and I am the Senior Teaching Fellow on the Masters, and I will be hosting today's session. I do have some colleagues from our team with me, and I will introduce them to you shortly. But to begin with, I want to start with some housekeeping and a quick summary of our plan for today. In terms of housekeeping, in this format, you cannot ask questions directly to us. All of our guests are automatically muted. So please put any questions that you have in the Q&A channel and we will address them later at the end of this session. Some of you have sent questions already when you registered for the open day. Some of these will be answered and addressed in the presentations you're about to see, but please do add any outstanding ones you have to the Q&A. So our plan for the session is that we will begin in a moment with some introductions, and I will then give you an overview of the programme. I want then to cover your journey through the MSc and highlight the key dates for you. Next, I want to spend some time discussing your research projects, and then we have asked the Careers Service to come and talk with you today. And to follow up on that, we will give you some details on where our graduates are. And then lastly, we will have the Q&A. So let's get started with some introductions. Can I have the next slide, please? Right, so here you can see all the people who are sitting very quietly, muted in the background, ready for their segment to start. With us today, we have Professor Mary Morell, who is our course director. Mary will be speaking in the last segment on what happened next and will join us for the Q&A. Then you have me, I'm Leanne Falkin, I'm the teaching fellow on the course. I'm also the module lead for the research projects. And if you do come and join us, you will see a lot of me on the MSc. My role is to support all of our students in all of their modules. I work full-time on the course and I'm solely dedicated to this MSc. Next is Dawn, our course administrator. Dawn takes care of all of the MSc's administrative processes, right from the moment of application all the way through to your graduation in May. And Dawn will be joining us for the Q&A. During the Q&A, you may also hear from Katrina. Katrina is the education manager here at the National Heart and Lung Institute, and she oversees all of our education activities, both undergraduate and postgraduate. And finally, today we have with us Victoria Sood from Imperial College's Careers Service. Now, we know that our Masters is a stepping stone for all of our students, and Victoria will talk to you about the support offered by the Careers Service for when you start to think about what it is you want to achieve after the MSc when you complete your studies. Next slide, please. So in this section, I'm going to give you a brief overview of the Masters. Next slide, please. So we know that there are a number of different Masters courses out there. So why should you apply for ours? What's so different about our Masters course? Well, this MSc in Cardiovascular and Respiratory Healthcare is unique in that it's the only MSc in the UK to combine both cardiovascular and respiratory science and healthcare. This really is key because there are many masters which focus on cardiovascular physiology or respiratory physiology, but this is the only one that combines the physiology of both systems. And this aspect is of great interest to our students and our potential applicants. And we know this because they tell us. They tell us in their applications to join the course, and they also tell us when we meet them at interview. Secondly, as you might expect from Imperial College, our teaching and learning has a very strong focus on academic research. But in addition, because this is a healthcare degree, we also have a strong focus on clinical engagement. And we do this by offering our students experiential learning in the clinical setting. And lastly, you're here with us today because you're interested in cardiovascular and respiratory healthcare. And as people who are interested in cardiovascular and respiratory healthcare, then the National Heart and Lung Institute really is the place to be. It's one of the largest heart and lung research centres in the world, and it is dedicated to improving cardiovascular and respiratory health, both through research and education. I mean, really, why would you go anywhere else? Next slide, please. And moving on now, in this slide, I want to tell you about what we will teach you. So in addition to in-depth teaching and learning about the physiology and the pathophysiology of the cardiovascular and respiratory systems, we will teach you about evidence-based practice. We will teach you to evaluate the most up-to-date research in the cardiovascular and respiratory fields. We want you to learn how to combine your ideas with innovation and technology to improve healthcare, to drive the field forward. And we want you to learn real-world skills to improve healthcare in the cardiovascular and respiratory fields. Next slide, please. So how do we do this? How will you, as our students, learn? So in the next academic year, we will be using a multi-mode delivery, which uses on-campus sessions, experiential face-to-face sessions, both in the clinic and in the laboratory, and also makes the most of our remote learning capacity as well. Our teaching is delivered by our clinical and research specialists and is supported throughout by myself, a teaching fellow dedicated solely to this MSc. And finally, our assessments reflect what we want you to learn. Our assessments are hand-on assessments, and this means they replicate tasks and situations in the real world. Sometimes you might hear these referred to as authentic assessments, and what we mean by this is that we assess your learning in a way which reproduces how you will go on to use your learning afterwards in your careers. Next slide, please. So in this slide, I've tried to give you a sense of the structure of the programme. All of this information is on our website, so I don't want to spend too long on it right now. But just to highlight that the course comprises 4 core modules shown here in dark blue: Foundations of Cardiovascular and Respiratory Sciences, Study Design, Reflection and Evaluation of Clinical Practice, and Quality in Cardiovascular and Respiratory Healthcare. Our students then choose 3 elective modules from a choice of 5. These are in light blue, and you can see those listed there. And here our students use their choices of their elective modules to weight their masters towards their cardiovascular or their respiratory preferences, depending on what their underlying interests are. And finally, towards the end, we have the research project in green. If you've applied to join us to study for a postgraduate certificate or a postgraduate diploma, then your structure will look slightly different, and we can talk about this in the Q&A if you put a question in the chat box, or you can approach us via our email address. Next slide, please. So who will be teaching you? And in this slide, I've put some faces to all of our modules. Here you can see the module leads for our core and our elective modules. Many of our module leads offer research projects too. And when you're thinking about your elective choices, please do Google our module leads. Look at their Imperial web pages. Look at any of the professional web pages they have. Some of them use Twitter, some of them write blogs. If you read these, you'll get a real sense of their area of expertise and an idea of what their module will cover. Next slide, please. And aside from the staff, a master's course really isn't up to much without you, our students. They are a key component of our programme. So who are our students? Many of our students will be recent graduates, and many of them are already healthcare professionals. They may be medics, nurses, physiotherapists. We have respiratory therapists. We always have a paramedic on the course. And we have sports coaches, and we have people from the pharmaceutical industry as well. It's a very, very diverse cohort, and this makes from an interesting educational experience from the point of view of both the teachers and the students. Next slide, please. And this is my final slide in this section of the presentations. And here I want to highlight the support our students get from the other sections of Imperial College. During your time at Imperial College, you will have support from the library, from our dedicated graduate school, from the Centre of Academic English, from the Careers Service, and you will also be allocated your own personal tutor. In addition to this, the Faculty of Medicine has produced 2 short online courses specifically to support its postgraduate students. The first is called Adapt to Postgrad, and this course is completed by students before they arrive. This course helps our students prepare for their move to postgraduate learning and the postgraduate learning environment, and to enable them to take greater responsibility and greater independence in their learning. The second course is Attributes and Aspirations, and our students work through this whilst they are studying with us. This has been designed specifically for Faculty of Medicine students and helps you plan for your professional futures after you graduate. You can read about both of these courses on the Imperial website, and you can also look at the pages, the web pages for the Graduate School and the Careers Service and the libraries there too as well. Next slide, please. So now I want to move on to talk about your journey through the master's course, and for this I have just one slide. Next slide, please. And this slide shows you a timeline of the master's course. The full-time master's takes 1 year, and the year is split into 4 terms, which you can see here. The timeline is summarised in weeks, and I've highlighted some of the key dates in terms of when things happen for our students. So if we start by looking at term 1, you can see that when you arrive, we start with your induction week. This is an induction to Imperial College, then an induction to the National Heart and Lung Institute, and then an induction to the Masters. Once you've settled in, shortly after that, I'll arrange a one-to-one meeting with you, in which we'll primarily discuss your elective choices, but we'll also speak about any early thoughts you may have about your research project. Then around about week 7, we will ask you to confirm your elective choices. At the end of the first term, we publish our project list. And in terms of teaching, the teaching which is delivered in the first term is primarily for the core modules, Foundations of Cardiovascular and Respiratory Science and Study Design. Moving on to term 2, the first sort of significant thing that happens is that our projects are generally allocated at the start of the term, and you will be invited to contact your supervisor. In term 2, you will complete most of the teaching and assessments for your elective choices, as well as the core modules Study Design and Reflective Practice. Looking at term 3, in this term you will start your projects. We also have teaching for one elective module and some teaching for the core module Quality. And lastly, term 4. This is essentially the summer, and during the summer you will work solely on your project. In this term, you can see we also have our exam boards, and towards the end of this term, this is when we as the college start the process of ratifying provisional marks and awarding degrees. Next slide, please. Right, so having discussed your journey through the master's course, I'd like now to spend a bit of time talking about your research projects. I'm particularly fond of this because I'm the module lead for the projects, but also it's a substantial part of your masters. The project is worth 30 credits out of the full 90 credits which comprise the full master's course. The projects last for 17 weeks, and as I said earlier, you select your project in December, the projects start in April, and then you submit your thesis in August. Projects are offered by academics at the National Heart and Lung Institute, and we publish the list of available projects in December. We offer a range of projects. We offer clinical hands-on research projects. These can be quantitative or qualitative. You can have a project which looks at service evaluation and improvement of healthcare, and we also do audit projects. Alternatively, you might be interested in doing some laboratory work, and we always have a selection of hands-on laboratory projects as well. Some of our students do a systematic review of the literature, and we also have data analysis projects using data from our research databases or international registries. Next slide, please. So as I said, the projects are offered by the academics at National Heart and Lung Institute. And I want to emphasise that they really are real pieces of research addressing real research questions that our academics have. The research carried out by our master's students during their projects contributes to the wider body of work and research work that we are undertaking at the National Heart and Lung Institute. And to illustrate this slide shows you two publications from last year's cohort. And there are also two other papers in preparation as well. So you can see that, you know, it's impactful research that we ask you to do during your research projects. Next slide, please. So having given you an overview of the MSc, spoken about your journey through our MSc and talked a little bit about the research project, I want for us all to consider now the question, where will the MSc lead you in your career? The image here is from our graduation ceremony in the Royal Albert Hall in South Kensington. You can see our academics parading on their way out, dressed up in all of their finery. Our new graduates are all sat in the front of the stage, and their families are up sitting in the boxes around the side of the Royal Albert Hall. But after graduation, what are you going to do next? So to talk about that, we've invited Victoria Sood from the Careers Service to talk with you a little bit about what the Careers Service offers and how they can support you as graduates and alumni of Imperial College. So next slide, please. Over to you, Victoria.
Thank you very much, Leanne. So, sorry, could I have the next slide, please? So, a big warm welcome from the Careers Service at Imperial College London. A UK Careers Service can be described as a central university department that provides information, advice and guidance to help students plan their careers and future. We help you look at your options, think about how you might develop key skills to increase your employability, and also talk you through and support you through applications for graduate level schemes or further postgraduate study. We're also a key entry point for employer engagement, both on campus and online. Each year we run a number of large events, both on campus and online, and our staff, including myself, are directly linked to academic departments. So this means that you will have experienced careers professionals who can support you making choices when you complete your degree. We work alongside your academic tutors, and one of the things that we will be able to do is work with you to help you come up with your individual careers plan to support you whilst you're here, and also we work with our graduates for up to 3 years after you finish. And I think that's quite an important point to make, is that we don't just let you leave at the end of your course. We're here to support and guide you for 3 years afterwards. We also run different events throughout the year, so we host several careers fairs, and we also give you the opportunity to meet with the recruiters from various sections such as life science, consulting, and lots of different areas as well. We have forums where employers and alumni come back and talk, panel discussions, and a lot of networking events that give you Q&A sessions to help understand the application process and how you can be successful when you move on. Next slide, please. So we give you the opportunity to have free, independent, high quality careers advice and guidance. So that means that we are completely independent and impartial in the advice that we give you. And you can access us at any point during your studies, and that includes the holidays as well. So we're open all the way through the summer holidays, and you'll be able to access the careers service and the support we offer once you are enrolled and have begun your course in the autumn term. We run general career sessions on lots of topics that you would expect a career service to do. So CVs, cover letters, interview preparation. We have sessions to support you on LinkedIn, networking, and we are also running additional sessions for students to help them make the most of the summer and explore opportunities in the current point in time. One of the things that we do in our individual sessions is we're very happy to not only go through career planning with you, but also to look at any job, PhD applications, with you and give you some constructive advice on how to improve these as part of your application process. One of the things that we do with this is work very closely with the graduate school. So as a student at Imperial College London, you'll be part of the graduate school, which offers a range of specific postgraduate related courses, and the career service deliver lots of those to help you gain the skills for when you complete your masters and think about moving on. Again, we work very closely with Leanne, and I came in and delivered a session for students earlier on this year, and certainly we'll be planning on doing very similar things in the forthcoming academic programme. There are a range of different ideas that people have when they're thinking about what to do next. Typically, people may think about moving into research careers. We might have students who are going back to their day job but looking at going in at a slightly higher level, and we have students that would be thinking about something completely different, and lots of students think about the scientist training programme. So we have lots of support and advice for you going into these different areas. And one of the other things that we would look at as well is support you with trying to source some postgraduate funding, so we can signpost you into the various resources where can help you apply for PhD funding. Next slide, please. When you are enrolled as a student at Imperial College London, you gain access to our Jobs Live system. So this is especially for students at Imperial. It can't be accessed by other people, and it's an online career management portal which allows you to make your career appointments, so you can have up to 3 appointments per academic term. You can source all the careers events that we have and book your place on them. We have a big jobs board where companies will look to recruit Imperial students, and we also have some exclusive opportunities where companies are seeking to recruit final year and master's students. Within that as well, we offer an online CV checking service. So if you're not able to book an appointment but you would like to have your CV checked, we can do that via My CV for you. So you can access us in lots of different ways. We're planning on our delivery in the autumn term to offer a mixture of online appointments and face-to-face appointments. So hopefully that will give you the opportunity to access us at a time convenient for you. Next slide, please. As you would expect from Imperial College, we have links with many employers. We run a huge variety of employee-related events during the academic year, and we hold our main careers fairs in the autumn term. So I think that's especially important for you as a master's student to be aware that a lot of the key events happen early on in the autumn term. In particular of interest to you is likely to be the Life Science and Healthcare Fair, which we run in conjunction with King's College and UCL. So some very big London universities we pool together to recruit a lot of companies from pharma, the NHS, lots of different recruiters, and this year that's going to be a virtual online fair run by sort of 3 key universities. We of course offer careers fairs and lots of other things, and if you are interested in those, you could have a look on the careers website and book a place once you start. So I do think it's important to be aware that lots of things happen in the autumn term. We run company recruitment presentations. Again, you may be thinking perhaps about using your skills and knowledge to move into healthcare consultancy. And you can book all of those on our Jobs Live site. We have employers that getting into talks, skills workshops to help you perhaps develop your interview practice, and recruiter in residences where employers will come in and you have the opportunity to have one-to-one conversations with them. We run lots of career forums and panel events, and there are quite a few that are dedicated specifically to science and healthcare options. So do have a look for those when you join us, which I hope you will be joining us in September. Next slide, please. A key question I think for anybody in the careers service is, what can I do with my degree? Where can I go on afterwards? What have other people like me done? And we recognise that with our master's students coming from such different backgrounds, it's important to do your research and to sort of explore where other people might go. Because this is a relatively new course, I know that you're going to have a little bit of information on the following slide in terms of what some of the graduates do, but also we think LinkedIn is a really good resource for you to use, because you can go onto the Imperial College London page on LinkedIn, have a look at our alumni and have a look at some of your specific areas and just browse what alumni have done in those areas. And I think it's really useful to do that, because you can see some of the stepping stone careers or opportunities they took in order to get to the career that they want to get into. And our alumni do tend to be really friendly and supportive, and so you may have the opportunity to network with some of those using LinkedIn. So in a nutshell, that's the career service. I think the key point to remember is that we are friendly and welcoming, and our main purpose is to help and support you making those decisions, even if you have no idea what you want to do. So thank you very much, and I think it's the next slide, please. Thank you.
Thank you very much, Victoria. And as Leanne introduced me earlier, my name is Mary Morell, and I'm actually the course director. Thank you very much to Victoria and Leanne for giving such a fantastic and comprehensive overview of our course. My job, I feel like I got the really nice bit at the end, because my job is to say, and what happened next. And as Victoria has said, we're actually a very young MSc. We've only actually been going this is our 3rd year, so we don't have lots of graduates yet. But as Leanne has shown, the graduates that we do have already achieved amazing things. So on the next slide, please. I'm not quite sure if you can see the next slide. Oh, here it is. Fantastic. I wanted to just highlight where some of these people that you're seeing in these 2 lovely photographs, which were taken before social distancing at the British Thoracic Conference, which occurs in December. Used to be face-to-face in the Queen Elizabeth Hall opposite the Houses of Parliament, but now is virtual. And all of our students would go, sometimes watch some of our faculty giving presentations. But members of the pictures that you can see have already progressed to PhD at Imperial College, and also research opportunities at Oxford University. And for some of our healthcare faculty, one of them is now lecturing at Brock's University, So already lots of people have gone on and taken up other research posts. For those of you that are clinical, you may be thinking about a change in direction for your clinical professional qualifications. And we've had people who have moved into clinical trials. We've had people who've moved into the charity sector. And also, I'd remind some of you to think about the role of technology in healthcare, and the NHS in particular at the moment is working in that direction. I'm sure Victoria will be able to point you in the right direction of that, but it's really will be a focus in going forward in healthcare, is the ability for the healthcare delivery to be both digital as well as face-to-face. We also have, as Victoria mentioned, links with industry, and we've had students who've gone on to work in AI projects as well as COVID-related projects. For those of you that are recently graduating and thinking, well, what kind of job would that lead for me? I'm not sure I've said that right. But one of the things that people frequently talk to us about is the role of the clinical scientists within the NHS. And so for those of you that might be thinking about issues related to cardiac monitoring, related to respiratory monitoring, the NHS runs specialist training programs, which are actually very competitive to get onto. And I would say that one of the things that you are getting when you come to Imperial is the access to all the great things that Victoria has outlined. So it's not just the course, it's the ability to tap into Imperial's wider network, which I think is really important. And my last comment is for those people who are thinking about graduate medicine. We also have students who've also applied to go on and do graduate medicine. This is not a selling point, but my other role at Imperial is that I'm head of undergraduate medicine for the first 3 years. So I do understand the challenges that you might be facing in that direction as well. So our MSc can lead in lots of different directions. We now have a wonderful alumni who are, as Victoria said, very generous with their time in terms of talking to people and supporting them. And I'm now going to finish, and thank you very much, everybody.
Thank you, Mary. All right. So thank you, Mary and Victoria, for for bringing us to a really great end for our session. Ending on where our students will go after they join us is a natural ending. I think for an open day like today. So so now we have some time for questions and answers, and Dawn, our course administrator, is going to pose some of those for us. So Dawn.
Hello everyone. Yes, we did have some questions come in prior to the session. So I'll start with the first question. Are there specific entry requirements for students from overseas, and what documents are required?
Right, thank you, Dawn. I will start answering that question, and then maybe Katrina can jump in if needed. So I think it's important to say that all of our applications are evaluated on a case-by-case basis. Specific details with regards to the course to the academic requirements are on our website. We also have the facility for students to make a special case application on the basis of their professional backgrounds as well. And for international students, there may be an additional English language requirement. Again, the details of this are on the website, but please do get in contact with us if you have any specific questions about your own circumstances.
Okay, so are you ready for the next question? Are there any work-based placements on the course?
This is a question that we get a lot, actually, Mary and I, when we're doing the interviews. So perhaps Mary can jump in as well if she wants, if she wants to contribute to it. There are no work-based placements as such. We have clinical opportunities for our students to attend clinics for their reflective practice module and also for the pulmonary rehabilitation module. But these aren't work-based placements. They're opportunities to observe clinical practice.
Yeah, I'm happy to jump in there, Leanne. The focus of the MSc is the learning outcomes, which you will be able to see on the programme specification. It isn't an opportunity, as Leanne said, to do clinical placements, but the teaching that we do deliver is in a clinical context. So when you're reflecting and learning the process of reflection, then we invite those of you that aren't clinical to participate in a clinical experiences so that you can reflect on how that might work for the patients. Obviously, it's important for everybody to know now that clinical practice is, a lot of it is delivered digitally. So for our medical staff, they're actually working like we are now, remotely. So our students have been able to visit remote clinics to see how things are working. Likewise, we have a big focus on healthcare prevention and living healthily, and that's both within the cardiac and the respiratory realm. But during the pandemic, all pulmonary rehabilitation face-to-face was cancelled. So our students have then worked with the healthcare professionals to see how the impact of that on patients. So we're very closely tied to our clinicians that teach our courses, and we are adapting with them to the current pandemic. But your teaching is university-based in a clinical context. It is not clinical teaching. So I think it's really important that we set that expectation for you so that you can understand what it is that we are hoping to achieve with you. It's a fantastic opportunity to work with people who are right at the front of the profession, and particularly our innovations in cardiology. You're using the most up-to-date papers to look at cardiology healthcare. Likewise, for the respiratory side of things, the National Heart and Lung Institute is the world leader for non-invasive ventilation. And so being able to work with these people, I think, is a fantastic opportunity, but it won't necessarily be the opportunity to be in clinic with them, if that helps. A long answer to a short question. Sorry about that, Leanne.
Thank you, Mary.
Thank you. So we had another question asking about the postgraduate certificate and can it be done alongside full-time employment?
Yes, it can. We have a student currently, a postgraduate certificate student currently, who is doing their studies alongside full-time employment. So yes.
I think it's probably worth saying, Dawn, that if somebody is planning to do that, it would be good for them to have a conversation with their employer, because there may be times when, although we're delivering multimodal, that they are going to need to be on campus. Some of our modules are delivered on the same day each week, sequentially each week, and some of our modules are delivered as a block over 4 days. What we've got better at over the 3 years that we've been running the course is getting the information to you soon enough for you to be able to request days off. But I know certainly for those people who've worked clinically, it can sometimes be difficult to get clinical time off. So we work with you to support you. And as Leanne said, we have had quite a lot of clinical professionals who've worked full time and still got both the SIR and also the MSc, which they've then done over 2 years.
Thank you so much, Mary. That's a very, very good answer. Somebody else has asked about the course outline. I guess that will be online, won't it? prior to the course starting?
With regards to the timetable?
Yeah.
So yes, the course outline, so the overall course outline is the same every year. So in terms of what modules we teach in what term and what happens when. Looking forward to the upcoming academic year, the exact ratio of how we're going to deliver that teaching is still to be determined. We're in the process of timetabling just now, but yes, that information will
Leanne,
be.
I was just going to jump in. I think Leanne's hesitating here because we've been challenged since the start of 2020 with making sure that we can deliver the MSc in the pandemic. So we won't put the timetables up on the website, but what Leanne did show today is where the blocks of teaching occur. And if anybody wants more information, if they email yourself, Dawn, at the Cardiovascular website, we'll be able to work with them to give them more information. But we can't publish the timetables at the moment because of issues to do with the pandemic and needing to understand what we can do face-to-face on campus versus what we need to deliver remotely.
Of course, thank you. I think most of the other questions have been answered during the presentation. I don't think there's anything else here, apart from somebody has asked, what is it like to study this course in Imperial College? I guess there's only one way to find out. Let's do it.
That's a great answer, Dawn. There is only one way to find out. Fantastic. So if that's all of the questions, then I think we should bring today's session to an end. Thanks again to everyone who's helped me today, Victoria and Mary and Dawn and Katrina, and also Lizzie and Helen, who are working behind the scenes but didn't get a picture on my slide. For our next open day, perhaps I will do that, and Katrina as well, and all of you for attending. It's been fantastic to to have you here with us. If you have any questions, please do get in touch with us. The email is on your screens now, and Dawn and I will endeavour to answer any questions that you have. And I guess the last thing to me to say is that I very much look forward to receiving all of your applications. Thank you.